U.S. health officials considered banning individuals from flying to prevent measles transmission. CNN. State and local health officials have consulted with the United States Centers for Disease Control and Prevention in recent months about the possibility of preventing individuals from flying to prevent measles transmission. Thursday. The 8 individuals were either confirmed to be infected, believed to have a high probability of having measles, or at high risk due to not being immune to the highly contagious virus and suspected of being in close contact with someone who has measles, CDC spokeswoman Caitlin Schaffee told CNN. She characterized the conversations as free discussions, and said that state and local health departments contacted the CDC to say, "We have people that we may have to place on the Do Not Board list." The Do Not Board list is a tool the federal government can use to prevent an infectious person from flying while sick, Dr. Martin Citron, director of the Division of Global Migration and Quarantine explained. This measure has been used since 2007 for patients who have tuberculosis, and in 2014 was used twice for measles. After trying to dissuade a passenger who is sick and contagious from traveling on a plane, state or local health officials may contact the CDC to request assistance. The agency then has to verify that attempts were made to prevent the individual from traveling and that the person has flight reservations. The CDC then speaks to the airline to arrange for any fees related to canceling the trip to be waived. Then the CDC works with the Department of Homeland Security to place the person on a public health do not board list, which tells the airline not to issue a boarding pass. Citron explained in an interview with CNN. Citron said that it's a persuasive option. 90-something% of the time when we inform people we want them to change their mind and we can tell the airline not to issue a boarding pass, they change their mind. In the instances that have come up this year due to measles, all of the individuals voluntarily decided not to travel without the CDC contacting them, Schaffee said. Which has reported 79 cases, and New York, which has reported more than 630 cases. The NYC Health Department has worked with 2 individuals who were not immune to measles to prevent them from flying during the 21 days after they were exposed to measles virus, while they were at risk for getting sick. Patrick Gallahue, spokesman for the New York City Department of Mental Health and Hygiene, said in an email, "No one has been placed on the Do Not Board list during this outbreak, and we have worked with passengers to minimize the inconvenience of travel disruptions in order to protect the health of New Yorkers and other travelers. People have been very cooperative." Citron also said that there has been a significant increase in the number of investigations due to passengers flying with measles, for example after someone has returned home from a trip and been diagnosed with the virus but was contagious while they traveled. The CDC works with the airline to inform at-risk passengers of the possible exposure. A person with measles is contagious for 4 days before developing the telltale symptom of the rash 4 days after. 880 cases this year, the highest number of cases in a single year since the virus was declared eliminated in the United States in 2000, and the highest number of cases in a year since 1994. Of the 52 measles investigations on flights this year, 21 were from domestic flights, 14 inbound international, 5 outbound IHR, outbound flights from the United States to another country reported to CDC by a foreign agency, and 22 international international to international flights with a U.S. resident reported to CDC from a foreign agency. Schaffee said, adding that, the difference on the last 2 is that outbound airs are from a United States airport to a foreign airport. International airs are flights from an international airport to another international airport with a United States resident on board. The problem is most of the time when we do contact investigations the time window for measles is narrow. We are hearing about it after the fact, so left square bracket our right square bracket ability to know about cases before they travel is infrequent, Citron said. There was one known secondary case of measles this year, meaning a passenger became infected while traveling from another infected traveler, Citron told CNN. We can't always say it was the cabin environment for sure. Citron said the best way for anyone to protect themselves and others from measles while traveling for any time is to get an MMR vaccine. Thank you for watching. Please subscribe.